Perhaps you have caught on. We are well past the first 100 days of Obama's presidency, and a total of $13 trillion has been lent, promised, or guaranteed by the government to throw into the bottomless sewer of the bailout scheme. All of a sudden, the refrain from Obama's inaugural address comes to mind, that we need to recall the sacrifices made in the past. But sacrifice is coming to mean something very different. Ever since July 2007, when the debt-based global economy lost the ability to turn over another debt and values collapsed across the board, there has been no recovery. There has been a concerted effort to share the pain, with international finance trying to share it with the private sector, until it was discovered that the private sector was broke. So they went to the public to share the pain by starting the fanatical bailouts and the austerity, telling you, everybody has to make sacrifices. Last Tuesday, Obama proposed cutting healthcare costs by $2 trillion over the next 10 years with the help and support of the leaders and major stakeholders in the healthcare industry. We should look at that HMO industry for a minute. This managed care system was sold to Richard Nixon in 1971 by John Ehrlichman, who told the president that HMOs were a for-profit venture, and all the incentives are toward less medical care, because the less care they give them, the more money they make. Today, the top 50 HMO companies controlling over half of the managed healthcare, making profits of tens of billions of dollars, have among their top institutional owners the very institutions that have been the recipients of the taxpayer bailouts: Bank of America, Goldman Sachs, and Barclays, the British bank that made a killing off the AIG bailout. So Obama wants the help of the medical care stakeholders in reducing healthcare costs. The question is, isn't he already working with them close enough on the bailout? When Obama spoke of sacrifices, when he said everybody's going to have to give, maybe he meant that everybody is going to have to give to London and Wall Street. Worse, maybe he didn't know the meaning of the words that were coming out of his mouth, but the behaviors dictating policy for him did. In Obama's healthcare reform program, it was revealed that the Federal Council on Comparative Effectiveness Research would be given a generous $1.1 billion out of the Economic Recovery Bill to research cost-effective healthcare. In other words, what medical procedures can be cut to save money, and who won't get those procedures because they can't pay. This council is led by Peter Orszag's deputy and euthanasia fanatic Ezekiel Emanuel, who wrote in October 2008 that depression, war, and bank bailouts will make it easier to force through austere healthcare reform, that the huge increase in the federal debt that these bailouts will entail intensifies the pressure to rein in healthcare costs. In other words, saddle the United States with an enormous, unpayable debt and push through the austerity. What then are we really being asked to sacrifice when we can afford $13 trillion in bailout, but for our own people we're told that everybody in the country is going to have to sacrifice something for the greater good? When he said that, did Obama mean human sacrifice? Because the president and other influentials around him are unwilling to admit that the system has collapsed terminally, they are going for fascist austerity and are willing to sacrifice human lives to save a financial system. President Obama must now take back the Hitler-like policies he has uttered under the influence of Larry Summers and Peter Orszag's crowd since his infamous trip to London. That means breaking Obama away from his Nazi behavior as brainwashers and canceling the HMO system before it is used by the president to put through the healthcare reforms in memory of London's personal creation, Adolf Hitler.